Tooth pain is one of the worst pains you can feel. And when you're in that position, finding an endodontist is the ideal for you. We endodontists are trained in pain, in facial pain. So learning all the nerves and the causes are part of our specialty.
Well, pain is very complicated because it's difficult to diagnose because the nerves are all connected in our faces. It's very common the patients believe that, no, I feel pain in this tooth and it's another one. So we have to check all that, but when you have the knowledge, you can predict which one or the cause and how to treat it.
You need to know if the pain is chronic or is acute pain. So the management of pain is, I think, is the most important in our specialty.
The most common symptoms for making you aware that you need a root canal might be extreme sensitivity to cold or hot liquids, especially drinking something really cold. It really aches. It spreads the pain around. It could hurt the ear, even your eye, to your nose, the neck. This extreme pain is mainly caused by a nerve that is pretty swollen, inflamed, and telling you it might need a root canal.
When that happens, we have to sadly do the procedure, that is to remove the nerve from inside your tooth to keep it working. If you don't do that, you're going to feel a lot of pain or maybe get an infection.
It's very important to remove all tissue inside of the tooth because that make an infection in the future if you don't do that. When we finish the root canal, the bone begin to form again, and the objective of the root canals or endodontist is conserve the tooth inside of the mouth.
Even though today we have the option of implants, it's never going to be as good as your own tooth. Think of it like replacing one of your fingers. It's not going to be the same to have a titanium finger than to have your own finger. It has different structures and it feels different, so it's never going to be the same. Dental microscopes have been in the business, especially in the United States, for some time already. But not many people knew about them, and they're a big investment. But once you understand the importance of magnification, you come to realize that the investment is worthy totally.
The good thing is the microscope helps you to see, and if you see, you can work better. The teeth are really small, and the root canals are smaller, so it's easier to work when you see what's going on.
With the microscope, we have different settings, and that can help to see the dark side of the tooth. That means, the foramen of the tooth.
With a microscope, I can do things that other dentists or specialists cannot do because they don't see. That's why it's very important to have the microscope.
In Mexico, endodontists go to different offices, right? If a patient needs a root canal, he calls the endodontist and he comes to the office with his tools or her tools. Only 3% of Mexican endodontists have microscopes, which is a very low number. When you have a microscope, you cannot travel to different offices.
We have very large equipment. The microscope is very heavy and large. It's impossible to move it to a different dental office.
The size is so big, you cannot put in the back and go out. You need to stay in your office and see the patient there with all your technology that you have, with all your machines that you need.
When you come to my office where I have my microscope, I feel more secure about what I'm doing. I feel the outcome is better. I can share the images with another specialist, let's say someone in the United States, in Canada.
If I can't use the microscope, I really feel frustrated because it's something that I cannot work with my eyes. So no one can work without eyes. So
if you don't find a nerve or you see a crack line, something like that, you're only going to see it with microscope, with magnification. The human eye is not that good to see small things.
Let's say, for example, in a different office, sometimes you have to do the root canal in 2 appointments because you didn't achieve finding one canal and you want to give it another try, you can spend even more time. So when you come to my office with a microscope, I feel so much more confident that I'll find the canals in that appointment, that we will achieve the result we want, even in less time. In the endodontic practices, everything is an emergency, everything is urgent. All my referrals call and they ask for the closest appointment you have, right? Everybody's in pain or starting with pain or with an infection. So the schedule of an endodontist is pretty busy. By using a rapid care protocol, you guarantee a spot in my office with a microscope. And this is different because if you would go to another clinic, they have to make a call to see if the specialist is available. And secondly, you're not going to be seen with a microscope. Cancellations are bad. They're bad for us, but also for patients who can be seen. So we found that when people pay upfront, even a little bit, they show to their appointments. This helps us to have our clinic with the chairs full and with a good workflow. The money you pay upfront is deducted from your total, so it's completely risk-free.
That's why we use the rapid care system, because it motivates you to go to an appointment to see what's going on. Maybe you don't need nothing, or maybe you need some treatment because you have an infection or an inflammation. It's for your safety.
When people talk about or hear the word root canals, it makes them shaky or nervous. That's why we try to provide you with the best care. So even if you don't choose us, seek someone with a microscope for the best chance of a successful treatment.